Hi, welcome to Marijuana Politics. My name is Romain Bonilla, and I'm sitting here with Joycelyn Elders. Mrs. Elders was the Surgeon General from 1993 to 1994 as part of the Clinton administration. Thank you for joining us.
It's a pleasure. Thanks for having me.
So, we're here at the International Cannabis Business Conference. Tell us more about the work you've done on drug policy.
Well, I'm not a policy wonk, so I haven't done a lot of work, but I've been supportive and I've been a voice, if you would say, to go out and really talk about some of the things that I felt we should be doing and some of the things we need to do to change the policies. And I've worked with some of our politicians to say that, give them the medical indications and why we need to change our policies and why some of the policies that we have been failed policies.
So your conversations as part of the Clinton administration have been somewhat controversial. Tell us more about the political reaction you got. Did you get any backlash for speaking the truth about drug policy?
Well, of course, during the Clinton administration and during that time, I was really asked a question about what I felt about our drug policies and my feeling about drugs. And I felt that we should study the effects of drugs, what's going on, what effects they have in the body. And I didn't know whether they should be legalized at that time or not because we didn't have enough facts. But I felt that the government should be involved in studying it and, if necessary, legalizing it so that it could be taxed and the funds used to make a real difference rather than leaving it all up to the gangs, the drug dealers. And so that was my thought about it.
Great. So as the top doctor in the nation, from a medical perspective, why do you think it's so important to reform these drug laws?
The reason I think it's so important to reform these drug laws is, first of all, the drugs that people are arrested for mostly is marijuana. Marijuana has never killed anybody. It's never caused a lot of the things that we are saying, and it's really been a war, if you will, against young black men and Hispanic men, or more people of color, and in neighborhoods of color. And so we've spent trillions of dollars, if you will, on something that has really made no difference. We've not reduced drug laws, and all it's done is made us build bigger, better prisons. The cost of keeping one prisoner in prison for 1 year is from $21,000 to $40,000 a year. And we could send a lot of young people, we could send them to college for less than we pay to keep them in our prison system, which really does nothing more than make them really not good citizens.
Absolutely. So let's talk about prisons. Hillary Clinton has been very, very cautious about endorsing plans for reform. Many in the marijuana movement, have criticized her for not taking a hard stance on meaningful reforms. She's gotten support from Big Pharma, from private prisons companies. As president, do you think she will champion the cause of marijuana law reform?
I think Hillary Clinton is a very smart, bright woman. I think she will do what's best for this country. And I think that we have to admit, first of all, she's a good politician. So you have to get elected. But I do feel, and I've known her for a very long time, and I feel that she will do what's right by children, what's right by women, what's right by minority or communities of color. And I really very much support that she'll do the right thing. She may say the right thing right now, but she's going to do what's right. When she gets the facts, I feel she'll analyze those facts and will do the right thing.
So great. Do you think under a Clinton presidency, a Hillary Clinton presidency, marijuana will be made legal federally?
I think marijuana is going to be made legally, federally, because the people of America is going to demand that happens. Our policies are changed by the people. And when the people decide that we need to change, it will change. And now 56% of the people in America are saying we need to change. Well, when the people of America feel that it need to be changed, it will be changed.
So let's stay on the presidential candidates for a second. A lot of politicians have been talking about rescheduling marijuana to Schedule 2, which would allow for research funds and looser restrictions on the use and prescription of marijuana. What do you think of Bernie Sanders' proposal to deschedule marijuana entirely? As a doctor, where do you stand about that?
Well, I certainly think marijuana, first of all, should have never been classified as a Schedule 1 drug. And the fact we certainly, if we reclassify it, we could certainly make it a Schedule 2. But then, it doesn't really fit there either. So I have no problems with reclassifying or declassifying marijuana to make sure that it can be. We can do the research that we need to do and make it available for people who want to use it and realize that it's far less dangerous than either alcohol or some of the other drugs that we're using. And we know that we're having a major problem now with prescription drugs. And if marijuana can be used, we could probably markedly reduce addiction rates and markedly reduce our prison population.
Absolutely. So you would support Bernie Sanders' proposal to deschedule and remove marijuana from the Controlled Substances Act?
I certainly would. Would certainly support that. I feel that marijuana, we don't have cigarettes on it. Mm-hmm. We don't have alcohol on it, and tobacco kills more people in the United States every year, preventable causes of death, than anything else we've got. So I think that marijuana should be removed and studied and looked at.
Yeah, absolutely. We're in agreement here. So let's talk about addiction. Elizabeth Warren, Senator Warren, has recently made a point of talking about the way that marijuana could help reduce the harms of opiate use. As we know, in the U.S., a lot of people are prescribed a lot of opioids, and those drugs can be very, very damaging to your liver and can also lead to addiction and all sorts of other problems. Do you think there's any merit to her argument that creating availability for marijuana would reduce or could reduce the harms of opiate use?
Well, if the people would, if using marijuana would reduce some of the anxiety we have, reduce some of the pain, that they are undergoing, and reduce some of the other problems that they're facing, I feel that marijuana could be very helpful. We know that we're using far too many prescription drugs, and we will have an epidemic, and we've got to do something about that. And if we could substitute marijuana and make it a legal drug, such that people could have it available, I think that would be very helpful, and it's certainly worth a try. We couldn't be worse off than we are.
Yeah. So while you were Surgeon General, you made actually a very good point about sex education in the United States. You advocated for very honest education in schools about what sex is about, and not everybody agrees about that. We have a similar problem here with drug education. What do you think of programs like DARE that don't tell the whole story about drugs?
Anytime we don't give the full story, that's a problem. I felt that our children should have a complete sexual education, and we need to make sure. When we talked about the use of condoms, they say, "Oh, well, condoms will break." I reminded them that the bowels of abstinence break far more easily than latex condoms. That we're sexual beings from the time we're born until we die, and I feel that if we can make sure that we give our young people an honest education about drugs, about marijuana. We may say, well, we don't want you to use, we tell our young people no sex until married, but we know 95% of people engage in sex before they get married. So we know now that something like 50% of our population over 12 years of age have tried marijuana. So why try and turn half of our country into criminals?
Great point. So there is a prominent presidential candidate who has a medical background, and that's Ben Carson. Ben Carson has gotten a lot of recognition for his work as a neurosurgeon. Do you think he'd make a good candidate for Surgeon General?
I think Dr. Ben Carson has proven that he's an excellent neurosurgeon. He's done outstanding work. He's not been into politics very much until he started running for president. And he's certainly been an excellent speaker in that regard. And I don't know whether he would want to be the Surgeon General or not, but I think that Dr. Carson is an excellent, a formidable candidate, and I support whatever he feels that he is going to try to do.
Okay. What do you think the next Surgeon General in the next administration, no matter who that is, what do you think the next Surgeon General should focus on? You've had a history of taking on the issues that matter. What do you think is the issues that matter now?
Yeah. Well, I think the next Surgeon General, or he or she, will continue to focus and make sure that all of our people have access to health care. And we've tried to overturn or throw out Obamacare. I don't care what we call it, but we need to make sure that all of our people have access to health care. And that includes good, honest drug education. We need to have comprehensive health education in our schools from kindergarten through 12th grade. Make sure that all children have good, scientifically based education, and not the myths or the lies. So I feel that the next Surgeon General will certainly be focusing on making sure that we have good education, making sure we have good health, try and make sure our young people are healthy, educated, motivated, and have hope for the future. That, to me, is what you need to be about. And that all people, everybody, have absolutely the best health that they can have.
Great. So what are you working on these days?
I'm working on my garden. And I don't have a marijuana garden. I live in the South, and we have primarily, but I do some speaking around the country, and I'm on the faculty, at the University of Arkansas, but I don't do much work. They just established a chair in health, education, disease prevention at the University of Arkansas, and the University of Minnesota established a chair in sexual health education in my name. So I'm very pleased about that, and that's required a lot of work, but I very much support that kind of, I'm very much interested in our young people growing up sexually healthy, and I want them addiction free, and whatever that whatever we need to do, I want them to be able to make good decisions. If you can make good decisions, you'll do the right thing.
So where can people find more information on what you're working on these days?
Well, as I said, I think they can probably go on the internet and find out as much about me as they want to know or need to know. But you have to remember, I'm 82. I'm retired. I'm trying to get bright young people to be leaders. I'm out there trying to develop good leaders to take over so they can take good care of me when I get 85.
What do you think marijuana activists should focus on in the years to come?
I feel that the marijuana activists should focus on getting rid of some of our draconian laws and to really focus on passing good, healthy laws governing the control, the growth, and a distribution of marijuana. I think that if we end up getting all of this done, if we don't have laws to regulate and control this, such that the funds can be used for social issues, health issues, enforcement is needed, well then, we'll fail. So, and we can't afford to fail. We've come too far. We're not there yet, but we've come too far to fall back to where we were.
Well, there you have it. Thank you so much for joining us. It's a pleasure to talk with you.
Pleasure to be here. Thank you.